I'm Iyamide Thomas. I work for the Sickle Cell Society. I've been working for them for quite a while, so know some of you here. I'm going to talk about the project that we did in collaboration with the UK Thalassemia Society, which was to get the service user experiences, but it was very important to hear the service users as well. I thought I'd give you a quick run through about what we do as a charity. We founded in 1979. Patients, nurses, and other stakeholders who thought there wasn't enough information in those days. They wanted to raise the awareness of sickle cell. A lot of awareness raising has been done now. We celebrated our 40th anniversary in 2019. I think some of you came to the gala ball. And we continue to try and enable people with the disorder live a better quality of life, both economically and socially. We do this, we have a helpline, we have support groups, we try and capacity build the support groups. Education services, we have some of our literature outside, so please during lunch go and take literature, the newsletter, impact report, it's all out by the registration desk to give you more information about what we do. We're on social media, we are on Instagram, the website, everything like that. We have an all-party parliamentary group for sickle cell and thalassemia. We do a lot of social research. The latest one we were involved in was sickle cell and fatigue in young people, and one of the collaborators is here today. We do campaigns around blood donation. We have a blood donation project specifically for that, to try and get a lot of black men involved in donating blood. World Sickle Cell Day, Rare Disease Day, that was in February. We were at a stall in Royal Holloway College. So we do a lot of that. But the key thing I'm going to talk about today is the collaboration we have with the screening program, which has been going on for quite a while. In fact, the society helped lobby for a screening program prior to me joining. I haven't been there that long. And we have a children's holiday, which during the pandemic went online, but it was full of activities for children with sickle cell. And we have a mentoring program, that's very important as well. So the societies, both UKTS and Sickle Cell Society, we're that interface between the service provider and service users. We help them, give the user voice and enable them to try and remove any inequalities that exist in the screening program. So we're that interface between the screening program, that very important interface, in fact, between the screening program and the people that use the service. We've worked with the screening, when I say we, I mean the societies, but I'll talk mainly about what we've done with them. We had a whole load of media support and things on in print and broadcast media. We'd go out and do a lot of, promoting the screening and raising awareness of screening, the myths. We had a very big program called The Family Legacy, which one or two nurses actually took part in that as well, going out to various venues, and you'll see that in my next presentation. We've done policy and research development. Some of you would know also resource development, about the parent stories, which was the first conference we had. There might have been one or two people there, and there's some of those booklets out in the foyer as well. So as a society, we do a lot with the screening program. That's the parent stories booklet, so that you might recognize it. There's some outside. And as a result of that research, evaluation we did, these were the changes that we recommended, and the program actually had a fast tracking of at-risk couples, etc. Yeah. So I'm going to talk about this project we did in 2023. Well, that ended in 2023. Today we're going to launch the report. The background Amanda went through, they engaged us to talk to service users so that they would do their protocol, update the protocol. So I'll skip that slide. How did we do it? It's an evaluation, not research, it's an evaluation we did, and we had semi-structured interviews. We have social scientists, both of who are here today, in the project advisory group, and they helped us, construct the questions and make sure that we were asking the right questions. The societies then recruited people through our networks, website, WhatsApp groups, social media, etc. And I'll show you some of the graphics for that. And the discussions that we had mine were on Zoom, and we recorded those discussions and had the feedback was professionally transcribed, and we analyzed the feedback and reported on the learning, which will come later, but that's the ultimate result. These were the themes. We had various themes to discuss in the focus group. Yeah. These are some of the graphics we used to try and recruit people. We had to do one specially for fathers because the men didn't come the first time. And then we also recruited people who weren't parents. Yeah. I did 3 focus groups. The first one had 10 mothers, all had children with sickle cell. The second one, we had to mix the men in one focus group. So there were 3 fathers and two preconception. And then we had a focus group with 5 preconception women. None of the men turned up. We didn't have enough to do a separate focus group. Some of the quotes, they spoke about guilt. They spoke about the father insisting he wasn't a carrier, but I'm sure you've heard that before. And one of the key things was they spoke about not thinking there was anything wrong because the results were late, and midwives telling them that, they would have been contacted straight away if there was anything wrong. That's the mothers. Again, we had a second mother who said she didn't hear from them, and she was told that means she didn't have a child, but she was shocked, when she was told the child had sickle cell. You can see some of the points that came out. They wanted psychological support between being told that between the child's birth and seeing the consultant, because they're told newborn has sickle cell, but there's, no psychological support in some areas. Yeah. COVID didn't hinder some of the access for antenatal screening. There's the dads, and that was a pertinent comments that came from all of the dads. Never Google your symptoms. Yeah. They spoke about stigma more, the dads, and disclosing to family. And it was mainly the dads that asked about financial support when they have a child with sickle cell. Funnily, the women didn't mention that at all. The new treatments, some of the dads, even though they lived here from Britain, but when they came, they didn't know, they didn't know about new treatments. And they said people coming, especially people coming to England, would like to know about new treatments. Yeah. Early diagnosis, the preconception group, they wanted it, the younger the better, they said. The ones that lived near a screening center actually knew about the screening program. They asked for psychological support for carriers. If you were in a relationship, there's one lady that was in a relationship and she thought she needed psychological support for that because she found out her partner had the trait as well, and she was wondering, what do we do? So yeah, psychological support, access to support groups, and trustworthy websites for them to go on to. Some of the key learning, the family dynamics. We had one mother-in-law who said her son didn't have sickle cell, just like I think was it Michelle or Roanna that said that? So we shouldn't be telling them no news, or rather you shouldn't be telling them no news is good news. And when some of the women thought, because the result was late, especially the preconception women, they thought, why does it take 28 days for sickle cell and not for the other conditions? So they were saying, is it because it's sickle cell? So I think people need to be aware that there are things that can delay results, and it's not an inequality per se, yeah? And I think the new protocol will have that. That's the hard copy, as you can see. It's not just electronic. And I just thought I'd end with, did you know that the 28th of June is International Newborn Screening Day?
So this is the thalassemia perspective. I don't think we say that word enough. We don't say thalassemia enough, I find. So please use it as many times as you like. Iyamide spoke about why we did this and about some of the method. I'm going to talk about our method specifically because it was slightly different. I'm going to talk about some of the findings and the themes that we picked up in the data, and we can discuss it a little bit, and then I'll show you some of the recommendations that parents suggested. So the methodology, can you all see this okay? I hope, Kevin, everybody is fine online. So we interviewed 16 individuals, 4 mothers, 4 fathers, and there was 8 preconception. And what was a bit different in our preconception group is that they didn't know if they had thalassemia or sickle cell. They didn't know if they were carriers. Lots of them came from areas in the world where it was highly prevalent, but they didn't know. But I will talk about the preconception with Iyamide later. In terms of the parents, as you can see, we had quite a vast, vast regions of the world where they were from originally, and different religions. And we did most of them as focus groups, but Iyamide talked about how difficult it was for fathers, so we found we had to do that at one-to-one interviews because we could not get all the men in one room at the same time. So we had a very sort of hybrid model. So now these were some of the main themes we found for our parents. So disclosure of the results, health literacy, reaction to diagnosis, and lessons learned. And I'm going to try to go through them very quickly. So in disclosure, there were a few themes that was picked up. Carl, I hope I'm doing okay. Timeliness. So one of the things parents really cared about was the fact that it took quite a long time for their child to be diagnosed. So as we know, in terms of antenatal screening, I have to say we saw a complete change from Parent Stories 1 to this, because there's been a vast improvement in thalassemia services, and that's a win, because now women are being offered screening in the times that they should. So I think in 90% of the cases we had, everybody was screened in time. And they were very happy with that experience. So they were very happy with how they found out, how that was told to them, and P and D testing and things after. They were very, they felt they were really informed. Where we found a bit of a difficulty was in newborn reporting. So this is a little bit about when parents receive their baby screening result. And one thing, Iyamide mentioned this, but a lot of the parents were told no news is good news. So when the parents hadn't heard from, their health professional for months, they thought their baby didn't have thalassemia. To suddenly be, had to chase that result up, and 100% of the cases that we spoke to, so that's all the parents, they all had to chase the baby's result. And that's quite sad. And a lot of them spoke about the fact that they went to the healthcare professional and asked, should I be worried about thalassemia? Lots of cases the healthcare professional said, actually no, don't need to worry. And then the mother, and there was one that I remember really vividly, she said, she sort of exhaled, and she's like, okay, my baby's healthy. And then within that 30 seconds, the nurse said, actually, I need to check. And she looked and she said, well, actually, it says you need more blood results. The mother then asked, well, what does that mean? Does my baby have thalassemia? The nurse said, probably. So I have to say, I have thalassemia major. I don't know if any of you know this. And I'd like to think that I really care about the patient perspective and our experience, but this really gave me a different understanding of what the parents go through, and that fright, and that life-changing event that they continue to go through. So what I have to say is that it was really disappointing to see how parents were told that their child had thalassemia. And I talked about how they had to get follow-up, but I'm not going to, you're going to read these quotes for yourself, because I think the way that it's expressed is really, it's really something. Now, in terms of communication and language, which was one of the other themes within this disclosure, people talked about when healthcare professionals didn't use medical jargon, so didn't try to impress everybody. I think sometimes for us we use these technical terms because it's our bread and butter. But for parents who've never heard about thalassemia and getting this life-changing diagnosis for their child, a world that they once thought they imagined has been shattered, it's quite a lot. So when they felt that people, took their time, explained things, broke it down, treated them like a human being and not just a case, they found that really positive, and they had lots of great things to say. Unfortunately, we couldn't say the trust that these parents came from, but I think their good work should be acknowledged in some forth. But these were some of the positive things that parents had to say. In terms of relevance of information, and you might think that I'm giving you too much information you don't want to know, imagine this for our parents. So I think the choice of how information is given to them, some preferred leaflets, some preferred videos, some preferred lots of different things, websites. I think it's what I learned from that, it's not a one-size-fits-all. You need to get to know your family in front of you and find out what their best method of communication and information is for them. Ask that question. Do you prefer which one? And that's not something going into this that I thought about. In terms of format, I think this is self-explanatory. Lots of our families, and I'd say the majority of them, found out about a thalassemia diagnosis through a letter. A letter where they had no support to contact after. They had to Google things, which is very frightening, because I can tell you, if you Google thalassemia, and then your first thing that pops up is life expectancy, it tells you that your child will not live past 30. Very scary for a new parent. And it starts talking about health conditions and heart failure from 13. I can tell you my mother went through this 30-something years ago with me, and that's still happening now. So the fact that these parents were just given letters and left for months, don't agree with that. So lots of them preferred to have this face-to-face, and we had some really, really good examples of how this worked in some of the trusts within where thalassemia is highly prevalent. And, this mother talked about somebody coming to her home and giving her the news in her own environment, making a cup of tea, they're sitting down, she felt safe, she felt secured. And lots of the families talked about the fact that when they had that face-to-face meeting, they were able to ask questions immediately. And, there was nothing brewing, there was no misinformation, they got it straight there. So something that we advocate for. We also had cases with people being called up on the phone and said, your child could have a severe blood condition. Can I make an appointment? No other news. So the families had no expectation of when they'd be called. I think that's something we learned from going with this, that when the newborn screening happens, that you tell parents, this is going to happen in 5 days, this is going to happen in a month, this is what we expect. If you don't hear, this is how to contact us. So that's some of our learning. Now, in terms of health literacy, I'm going to go very quickly through this, because this was about the parents' knowledge of the condition. This was about how they inform their friends and family and the kind of role of ethnicity and culture. In all of our parents that we spoke to, one of the parents knew that they had thalassemia trait. The other parent didn't know. A lot of the time, because they were healthy carriers, they felt this had no implications on their child. So when they learned about the risks of thalassemia after and I remember this mother talking about, we're healthy and we gave this to her. And now she's not well, but we're fine and we did this. There's lots of guilt. There's lots of that. But she said, if only I knew what I was giving to my child, I would have done things differently. So I think you'll find that quite an interesting section to read. In terms of informing friends and family, one of the most difficult things for a parent was telling their parents or the grandparents. So the older generation had very different ways of thinking compared to their siblings who they felt were more supportive. So I think, again, another learning point for me was that when we help parents, we advise them on how to communicate this to the parents and give them tips of what might have worked for other families so that they can make that model that works for them. But for when I remember one parent saying, I couldn't even pronounce thalassemia. And then the parents asked them about thalassemia, like, what was the condition? They're like, I don't know. And then the parents were like, you didn't do your job as a parent to understand. So there was lots of blame factors in play. And fortunately for all our parents, the men didn't question if they had thalassemia or not, but what we found, it was the paternal grandparents who were more, I think, cautious that they couldn't have had it, and it all had to do with the mother. So I thought that was quite interesting. Reactions to diagnosis. This was really difficult for me. Parents felt, apart from like worry and anxiety, guilt, shock, panic, they were really, I think the guilt really outnumbered everything for them, and they go through a different sort of phase. They felt, and I remember one of the parents said, "We are to blame for this. We did this to our child. We should have done our research." But how would you do research if you didn't know about it? And they talked about the fact that when they were being told about CVS, that once they heard the word miscarriage, they completely stopped, and they wanted nothing to do with it. And I think what they didn't realize, and I found quite interesting, is that the 25% that their child could inherit thalassemia sort of went out the window, but the 2%, under 2% that the baby could have, you can miscarry, really, because that meant death, and that meant the end. Some of our parents who did decline CVS and those things had previous miscarriages, so they were completely terrified, and you can understand why. So again, have those conversations with them. And in terms of lessons learned, I don't know what I'm doing for time, but I'm almost finished. Yeah. Lessons learned, I think they learned about that education is key. They learned that they had to become their child's advocate, which is one of the most difficult things to do. It's really difficult to advocate for yourself, but you have this baby and you're learning about this condition, and that's something they found really, really difficult. I think, and that's where we get involved. And I think when you learn about the kind of work that we do, and Iyamide talked about what the Sickle Cell Society does really, really well, and we do a similar sort for our thalassemia patients, we help them learn how to advocate. We teach them in languages that they'd understand, in ways that they would. So please utilize us. We're there to support you and the patients. And I'm just going to whiz through this. These are some of the recommendations. So it's kind of how results are given, some of the things that I talked about while I was going through the slides. Psychological and emotional support, early screening and diagnosis, tell them as soon as possible. Financial costs and concerns was raised by the fathers, interestingly, and that was something they were very worried about. And yeah, I think that's really all I'm going to say today, but thank you very much for listening to me.